Hi, I'm Angie Buss, and I'm Peggy Watson's behavior consultant, and I'm here to provide training over Peggy's behavior support plan for December 2018. In the home, you should find Peggy's behavior binder. If you could try and look through this and familiarize yourself with it. The first section is going to be her behavior plan. The first 2 pages, if you could just read through those are kind of summarize everything. The other stuff is a little bit of historical information and the assessment and just different things that'll probably bore you. But again, please feel free to read, but the first 2 pages, definitely if you can try and read those. The second page, you're going to have the training forms, which is what we're going to go over today. The third section is going to be the behavior tracking sheets, which we'll go over those. There is a monthly behavior tracking sheet where you would write the month and the year. There are what we behavior consultants call the ABC sheets. It's going to be the antecedent, the behavior, and the consequence, and we'll go over that. You guys do your memos, and Sheila and I have talked, and as long as I'm getting data, that's fine. But again, you might just want to familiarize yourself. This will give you different ideas and different ways to write it. The next section is going to be the replacement behavior sheets, and we'll go over those also. They're going to be more like a little graph form that you're going to check off. And then if there's any new psychotropic medications, we want to document those. And then just the training sheets, or not training sheets, but like her behavior plan that the team signed, any quarterly meetings we have. And then the last section is just going to be her informed consent to treatment to continue with behavior services, the release of information, rights and responsibilities, and things like that. So the behavior binder will be in the home. The training sheet we will go over today looks like this. You will have 2 signature sheets that I need you to complete with this. They look very similar, but if you'll look, the boxes are different. They're going to be over the behavior support plan, the functional assessment, the ABC data tracking sheets, and the replacement behaviors. And those are all the things we're going to go over. So as you complete them, staff will sign, and then the trainer will sign. Staff will sign and the trainer will sign. So please make sure you fill those out too. The behavior training sheet, the competency behavior support plan training, you're going to put the date, the client's name, Peggy Watson, you are the trainee, Angie Buss is the trainer, or Sheila Sheets will be training you, and then the training or facility, you guys are probably residential. What are the client's target behaviors? So 1A is going to be physical aggression. 1A is physical aggression. I'll read you the definition. You don't need to write the definition, but you need to be familiar. Again, 1A, physical aggression. This is defined as Peggy when she hits, kicks, pulls hair, lightly strikes, pushes, grabs, things like that. 1A, physical aggression. 1B, verbal aggression. Again, 1B, verbal aggression. This is defined as Peggy when she cries, screams, yells, and name calls. 1B, verbal aggression. And 1C is incontinence. This is the loss of control over her bowels resulting in urinary and bowel accidents. Incontinence for 1C. Question 2, what are at least 3 antecedents that occur prior to the behavior? 1A could be things like change in her routine or schedule. She can get upset if things change. B, overstimulating loud environments. She can become overwhelmed and want to escape and act out. C, a lot of times at work, if she has nothing to do, she gets bored and she'll act out. A couple other examples are being presented with task or request if she's asked to go to the bathroom and she doesn't want to do that. Being told to stay put. She often wants to socialize and interact, and that's hard. She is very independent. She often wants to just get her own things and do her own things, but that can be a risk to Peggy as she could fall or get hurt. She does have a gait belt. People yelling, being loud. At work, she becomes very anxious. Maybe at home, if the roommates are yelling or yelling at her, sometimes she'll start the yelling or they'll start the yelling, but she becomes upset with peers and roommates, coworkers yelling. She can also become upset remembering about her mom. She lost her mom in June of 2016. Her dad's health is deteriorating, so he often forgets to meet her when he says he's going to, or to call and check in. She can become upset by that. So those were more than 3 examples, but you only need to write the 3. 3, what are the functions of the client's behavior? A, attention, and B, escape. Those were, during the assessment, those are the 2 highest. They're pretty close. Peggy competes for a lot of attention, and she also acts out to escape tasks or demands, or she might also be in some pain with all of her medical issues that kind of seem to come and go and that she is going through. So to alleviate pain, she could be acting out too. Please list 2 of the replacement behaviors, again, in the behavior binder. The data tracking that we have, the monthly log, that is just going to be where you would write the month and the year. This is a calendar for the first day of the month to the 31st day, or however many days are in the month. This is first shift, second shift, and third shift. If you're working first, second, or third with her and she has a behavior, check yes. And then you will have your memos, or you could fill out the ABC sheet or your memo logs. If there's no, there will be no ABC sheet or memo log to document that. So those are the monthly tracking sheets. Again, these are the ABC sheets. You guys fill out your memos. Again, right here, usually write a pretty descriptive narrative of what happened. That just familiarize yourself with different antecedents that could happen. Maybe you asked her to do something, the activity stopped, she wasn't getting attention, she was in a disruptive environment. She could not get the desired item, you didn't notice anything, she complained of being ill or being in discomfort. Another thing to note is the time of day that it happens and how long it lasts, the duration. You're going to check, was it physical aggression, verbal aggression? It was probably both. A lot of times if you have the physical aggression, it's a behavior change. Verbal aggression is often associated with that. The incontinence, or if there's a mark for other. If you start noticing she's having a new behavior that you haven't seen before, that's kind of starting to worry you, document that too. Consequence, did you ignore? Did you give social disapproval? Did you verbally redirect? Did you give physical guidance? Did you remove her from the area? Did you response block? Did you have to manually use physical restraints? Did you have to contact the behavior consultant? And then just write your scenario. That brings us to number 4, list at least 2 replacement behaviors. Number 1 is Peggy completing her checklist. These things can change. Right now we have doing her physical therapy, brushing her teeth, using the restroom, no verbal aggression, no physical aggression, and no incontinence. At the bottom of the chart is day 1 through 31. Please initial if you worked on those things with her and she didn't have her target behaviors, you would initial that. So again, the first behavior, replacement behavior, is completing her daily checklist and goals without engaging in target behaviors of verbal and physical aggression. Replacement behavior 2, improved social and coping skills. Improved social and coping skills. And I'll just give you a couple examples. Please respond enthusiastically when Peggy makes good choices and behaves appropriately in her actions with others in all environments, including home and work. Again, catch her being good when she's doing what you like seeing. Be sure to be specific about it and praise her for it. You guys will try and teach and model appropriate social skills that she can imitate. Clearly explain your expectations of appropriate social skills. When you're at home, when you're going on outings, we kind of call it preview and review what you expect to happen, and then what will happen. You know, we're going to have a good time on this outing. We're not going to get upset in the van ride. If plans change, we don't need to get upset. And when we get home, we can watch a movie or whatever reinforcing activity you guys want to do. Also use times throughout the day to use the memo logs and the ABC sheets, things that have happened, and talk about those with Peggy. Hey, what could you have done instead? What are more socially appropriate behaviors? You could have asked for help. You could have asked to take a break. Count to 10. Take 10 deep breaths. Ask for a drink of water. Listen to some TV. Listen to music. Ask to talk to a preferred adult. So again, just lots of other different examples. But again, these are the replacement behaviors. These are things that you're training on throughout the day. Again, day 1 through 31, we only have you initial that you try to do it with her 3 times, but there's hundreds of opportunities throughout the day to teach her more appropriate social skills and replacement behaviors. Number 5, her psychotropic medications. A is Prozac, Prozac. Peggy takes 20 milligrams daily of Prozac. 5B is Buspar, Buspar. Peggy takes 10 milligrams 2 times a day of Buspar. And 5C is Trileptal, Trileptal. She takes 150 milligrams 2 times a day of Trileptal. I know she's on other medications and things. I only have to document the psychotropic medications. What are some strategies to prevent the problem behaviors? You can teach Peggy ways to keep herself occupied when she's not engaged at work or while she's waiting. She often acts out at work if they don't have jobs for her. It's hard for her to be patient and wait. She immediately wants to get busy. Again, she feels valued, and she feels that when she contributes and she's doing something, that really makes her feel worthy and that she's contributing and doing things. So 1 is teach Peggy to keep herself occupied. Number 2 is teach Peggy appropriate ways to gather attention. Teach Peggy appropriate ways to get attention. C, teach Peggy appropriate ways to express the sadness for her loss of her mom. A lot of excuses after she acts out. She says it's because I'm sad, I'm angry because I miss my mom. So teach her appropriate ways to express the loss of her mom. D, add pro-social skills to Peggy's repertoire. So add pro-social skills. Again, all those replacement behaviors we were talking about, modeling, imitating appropriate social behaviors, what she can do when she's upset. You could be doing that. E, you can give her additional responsibilities or chores that match her interest. Again, she loves being helpful. Ask her to help you with different things. We all feel better when we help people. So help her, ask her to help you. And again, you're modeling that she needs to ask for help. Emphasize the importance where Peggy has skills. Peggy loves her outfits, loves to match her clothing, just takes pride in how she looks and everything, things like that. So anything that she's good at, I know she liked to bake with her mom. She likes to make meals for her dad. So cooking, doing crafts, she likes to do a lot of that stuff. So you guys could work on those things. Let's see. Teach Peggy ways to communicate distress. If she is in pain or not feeling well, she needs to ask. We've got her drinking a lot of water now. She could always ask for aspirin if she has a headache. I know complains a lot of allergies, so maybe there's different allergy medicines or nasal things that she could try. But teach her when you're upset or when you're in pain, you're not feeling well, you can't engage in verbal aggression and physical aggression with us. You need to ask us for help to try and take the pain away. Or allow Peggy to take breaks. Try and kind of read her if you feel like she's had too much stimulation, she needs some downtime, that's fine. Always trying to read her cues, allow her to have breaks. Remind her she can always take a break and ask to have a little bit of quiet time or get away from her roommates. If she wants one-on-one time with someone, that could be something that she earns, she's working towards. So I think those were a lot of examples. In her behavior support plan, she does have 2 restrictions. Number 1, they look at medications as a restriction, and number 2, she can lose her outings if she engages in her target behaviors. So again, discussed that with Sheila and with me specifically. I think we decided a certain number and if they last in certain duration. Again, it can seem subjective, so make sure you're talking with Sheila and, hopefully we're monitoring through the behavior logs if the behaviors are increasing in intensity and duration. She has many opportunities for outings, so she's always going to be doing something, but we always want to link it. Like, Peggy, you're doing so well. You haven't had an outburst today. I'm looking so forward to going on the outing with you. She might already be getting to go on the outing, so she's already earning these things regardless. But again, we want to tie it that it seems like it's tied to that. And again, she can lose outings, so we do have that approved through the human rights that she can lose outings if she acts out in physical aggression and verbal aggression. On the back 7, please explain how to accurately document the behaviors on the ABC sheets. I've got to wrap up. This will only go for 15 minutes. Again, the ABC logs, the behavior sheets. Contact me, any questions, anything like that. Again, if it's an emergency, call 911, follow your protocol. You would print and date, and the trainer will print and date. Thank you very much. Thank you for all you do for Peggy, all your hard work, and we just appreciate it.